Hi, may I come in? Thank you. My name is Mahalit and I'll be your nurse today. Thank you. May I please check your wristband? Can you please say your name and date of birth? Perfect. Thank you. Today I'm going to go ahead and change your dressing. Is that okay? Thank you. I'm going to give privacy. I'm going to go ahead and wash my hands. And after I wash my hands, I'm going to go ahead and put a clean gloves in order to remove the old dressing. So I'm just gonna go ahead and pull it, like the direction has to be parallel to the wound rather than pulling it. Okay, so make sure you do it like slowly so that you don't hurt the skin. Just gonna open it a little bit on each side. Pull the skin a little bit, don't hurt the skin. Okay. And then I'm gonna take off my gloves and discard this. I'm gonna wash my hands and apply the sterile gloves. Just gonna move this a little bit so you can be able to see. 2 inch from inside. So I'm gonna go ahead and do a little pinch. And then now I'm gonna go ahead and from like this part. Okay. And now this is my dressing that one I'm putting. I'm gonna get my gauze. And I have a glove. This glove is for the patient, so it doesn't, when he talks, it doesn't breathe on the wound, just to prevent infection. So, and right here I have my normal saline. So first thing we're gonna do is I'm gonna get my gauze. This hand stays sterile, and I'm gonna wash it onto one stroke, and then I'm gonna discard this. I have a discard here. Get another one. Get my normal saline. Do the other side. And again, I have a trash here. I'm gonna discard it. Normal saline. Gonna do the middle. Discard it. And now I'm gonna go ahead and dry my wound. And I'll do the same thing. I use one pat dry, discard, pat dry, discard. Gonna go ahead and pat dry the middle. Okay. Now as you see, I cleaned my wound. I dried the wound and clean everything. So what I'm gonna do is now I'm gonna go ahead and inspect tissue, the color, odor, if there was any drainage that needs to be measured, right? And I'm gonna check it. So no drainage, the skin looks good, it's healing. The tissue, as you can see, some granulation tissues, so it's good. Now it's still dry. I'm gonna go ahead and apply my transparent dressing. Okay. Gonna grab it. Okay. So after I grab, I'm still gonna be maintaining my sterile during the procedure. Okay. So I'm gonna go ahead trash. Apply the dressing. And after I apply the dressing, I'm gonna take off the white part. Alright, and it's gonna be trash. So now, as you can see, I applied my dressing, and now what I'm gonna do is I'm gonna dispose of all solid dressing materials properly, and I make sure make sure that I put my initials, my date, and what kind of garlic I used on the dressing at the bottom, so they know per doctor orders is going to be changed. And it's always good to put your initial and the date. It's very important. Okay, I'm gonna clean my area. And make sure you dispose your gloves properly. And discard this, and then wash your hands, and you're gonna say thank you for being so patient. Do you have any pain? You need to ask if they're experiencing any pain. No pain, it's good. So you're gonna discard everything properly to the trash. All the items you use is going to be get discarded, and then you document your findings. Make sure you document your findings, and then you wash your hands, and you make sure undo the privacy for the patients. And today's skill with this. Thank you so much for staying with me. Thank you.